I specialize in adult reconstruction, which essentially means that I do hip and knee replacement. I also do revision, hip and knee replacement. I've had patients ask me before if this were my wife, my mother, whatever, what would I do? And the answer is exactly the same thing as I already told you, because it's what I would do for my wife or my mother, or fill in the blank.
We moved here to the Asheville area in 2016. Immediately saw Dr. Lavigne, and in March of the following year had both knees replaced. And the coolest thing about it is that prior to that, I've always had bowed legs. So my left leg was still kind of bowed out, but my right leg had caved in, so it was bowed in. So this is actually the first time in my life I've ever had straight legs. It was kind of an interesting thing. And even after it's been almost a year and a half now, I still look at my legs in the mirror and find it difficult to believe that it's my legs. So it's been kind of an interesting journey.
One of the reasons I chose orthopedic surgery was the ability to very quickly change the quality of somebody's life. I often will operate on people that other people won't. They've been usually passed over by multiple orthopedic surgeons before they get to me. And I will try to do whatever is in my power to get them back on their feet.
And the real irony of the story is that when we first got here, my wife Carol was actually looking for a doctor because she was having some hip issues. So the way this thing progressed, I didn't expect to be having my knees replaced as early as I did, but it turned out that I went first and Carol came after that.
And basically what Dr. Lavigne told me is if it keeps you from doing what you want to do, then it's time to get your hip done. And he had told me I had quite a bit of arthritis in there, and so it was just up to me as to when to do it. And kept trying to play a little pickleball off and on and not having much success. And so I decided that it was time.
I will actually spend time with the patient and listen to their story. There's a lot of the time that patients are seen in orthopedic or specialty practice. They don't get a lot of time with a physician, and they feel like they weren't heard. That's not a feeling that you'll get here.
More than anything is the number of people that have asked me who was my doctor, because not everyone has had certainly the good experience that I've had. We've got a number of people that have had to go back for revisions and things like that. So I'm definitely one of his bigger fans around here, for sure.
The process was amazing. I was out of the hospital in a few days. I was on my feet the second day. I was back playing pickleball in 3 months.
At the end of the day, the reason that I went into orthopedic surgery was to make people better and get them back to do the things that they want to do.